Hey, what's going on? Doc Danny here with the PT Entrepreneur Podcast, and today we're talking about a change in the business model, in the cash-based business model, that is something that is starting to become very obvious to me that there is a better way than what we've been doing. Now, I'll give you some context to this, and I'll give you some data and some reasons why I feel this way, and what you can do about it. So, first of all, when I first started my clinic in 2014, I was by no means the first person to start a cash-based clinic, but I definitely was one of the first people in Atlanta, and I only knew a handful of people in the country that had started a clinic like that. One of those people was Kelly Starrett, who I'd left the military to teach for, and was working with his group at the time called Mobility WOD as their tactical director. And he was one of the few people, as well as one of our one of our other instructors, Teresa Larson. Her and her husband were in the San Diego area and had started a cash-based clinic as well. And what I saw was they were all charging between $150 and $300 an hour, and people would just come in and pay you for that, and then they'd come back as many times as you told them they needed to. I guess I didn't really know what to do, right? So that's what I did, and what we found was that on average, people were dropping off around visit 2 or 3, and part of that is we didn't really know how to sell, we didn't really know how to communicate as well, lots of reasons, but that's symptomatically when they feel better. Right. So they would drop off around visit 2 to 3. In your head, you're saying, oh, they're already better. Awesome. I'm really good at my job. And in actuality, they probably weren't. They probably had really good symptomatic relief. And then ultimately, whatever they were dealing with, most likely probably came back because we didn't really have a chance to solve the root cause of whatever was going on. Right. And in order to do that, that's when we started looking at things like packages. And this is one of the first conversations I had with someone who was not a physical therapist, who was a business owner, that asked why I didn't just package up the number of visits that I needed in order to sell that to somebody at the initial visit so that they would stay compliant with that. So that's what we started doing. And it was at first 3 visits because I didn't feel comfortable selling anything more than that. And then we bumped it up to 6, and a lot of people we end up seeing between kind of 6 and 12 sessions over a period of time, usually, kind of 2 to 4 months, maybe longer, depending on what's going on, if they have something more chronic. So anyway, that's what we started doing. And eventually we realized a little bit more about sales, a little bit more about how to structure this and how to improve that, how to anchor things, and how to actually have like a logical sales process. And the vast majority of people that work with clinics that we work with today, they're kind of acute on chronic, whether they be youth athlete, active adult, whatever's going on. Like for a lot of them, they have injuries that are going to take about 3 months to resolve. And that tends to work really well with like a 10 visit, maybe an 8 to 12 visit range, depending on the packages somebody has in place. So with that, though, there are some inherent challenges. One of those is, again, symptomatic change. As people get towards the tail end of a program, they end up sort of banking their visits. They hold on to them, and then they wait until maybe something happens again, and they're essentially dictating their own plan of care with the visits that they've bought versus you telling them what they need to do in order to get the outcome that they are trying to get. So we end up with a lot of these visits that sit on the books, and that's a negative liability on your balance sheet. They're obviously not moving on to anything else if they don't use the visits that they have. And also, if you have somebody that comes in and you tell them they need to see you 10 times and they end up getting better in fewer visits, they almost feel like a buyer's remorse. And we've heard this, straight from patients about that. So last year we started really sort of trying to figure out, is there a slightly better way of positioning this and having the sales process do a number of things. Number one, it drives completion. Completion is what drives continuity visits. So a continuity visit is somebody coming in after their initial plan of care. If they still have visits sticking around, it's unlikely that they do that and they kind of hold on to them until they have an injury. So we want to know, is something that can drive better completion. Could we have a higher average visit rate without necessarily a direct price raise? That was something that we wanted to know if we could accomplish. And the last thing was, we wanted to make sure that it aligned with the biological healing rates that we see with injuries that we have. And when we make prognosis and a diagnosis, that prognosis in particular is tied to the diagnosis and the duration of time that's going to take for somebody to have the healing necessary based on the biology that we know exists, and we can maybe accelerate that to some degree. And more often than not, we're essentially abiding by the biology that we have, and we're trying to put the best things in place in order to have the outcome that we want, and to remove things that are going to make us take a step backwards. So as we started testing that, we realized that the ability to have an outcome versus a package was a very important next step. And this is something that we tested for months and collected a lot of data, and now have implemented this in dozens of clinics, and have found some really interesting data. I did a webinar on this maybe a month ago, and I shared some of this data more in detail. But when we look at the front end of a sales process, I'm a strong believer at this point that there is a slightly better way to do this. And granted, let me take a step back and say there are dozens of clinics that we've worked with that are based off of packages of visits that are 7-figure or multiple 7-figure cash-based clinics across the country. That business model does work, and it does scale. There's no doubt about that. So when we look at iterations on things, sometimes it's actually harder to fix something that's working. If you look at, let's say you're a good golfer, but that there are there's flaws in your swing, and that for you to go from maybe you shoot an 80 on average, and you want to get down to like a 72, and you want to be a scratch golfer. In order to do that, you're going to have to retool your entire swing. You have to ask yourself if it's worth it for you to make that adjustment and that change based on the goals that you have. So, changing something that's working is actually really hard. It's very easy to change something that's not working. So as we looked at this, and now that we've really helped implement this sort of outcomes-based sales process versus a visit-based sales process, it's very obvious that it is a better path. Like if I was to start a clinic over again today, this is the direction that I would start with. The challenge is changing. There's some friction around that, and that's usually what stops people. But if you look at the numbers, it's pretty obvious that one is better than the other. We've seen a 26% increase on average with the clinics that we've had implement this and collected data on. 26% increase of their average visit rate. So that means if you're charging 200, then now you're getting close to 250 when you implement an outcomes-based approach on the front end. If you look at continuity, so what percent of people that come in to work with you end up moving on to a secondary purchase or long-term work with you, we saw that was basically settled in around 42%, so a little over 4 out of 10 people, which in the clinics that we looked at that did a visit-based approach, it was closer to like the mid-20s. So a pretty significant change as far as that goes. And a lot of that had to do with people completing what they were doing. And then the last thing we saw was the in-visit conversion percentage. So your evaluation to a plan of care, the conversion percentage of that went up about 10% as well. Now we had some people that went from 40% to 60%. We had some people that went from 55% to 65%. It kind of depended on where you're at across the board. If you're already in the mid 60s, we saw a clinic that went from basically 64% to like 68%, which isn't a significant difference, but damn, it's hard to convert higher than like 70% at scale with multiple clinicians, right? So naturally, it was a little easier sales process. And it's because the way in which I think it makes the most sense is to tie the initial evaluation to the outcome that somebody tells you that they want, and then to use your clinical skill set and a very thorough evaluation to then be able to explain to them what that is going to take. Here's what you want to do, and this is honestly what it's going to take, and to be agnostic to what the answer is based on what you think that they have financially or not. This is a huge mistake that I see. It's just like, well, I don't think this person can afford to do this, or this. Like, that's a huge mistake. You do not. Don't disrespect somebody by thinking that they don't have the means to do something, the will to do something. And you should, at a minimum, start by giving them the option that is appropriate based on your assessment as a professional. If there are true limitations, then we can get creative and try to figure things out. But if somebody wants to know, what do I need to do? You need to tell them that. So, as we look at this process, the biggest difference, for this is like to go from visits to outcomes is really the big difference. Instead of you saying, I need to see 10 visits over X amount of time, it's that this is going to take X amount of time, and this is what it's going to look like along the way. So when you switch visits for the duration of time needed based on your diagnosis, when it aligns with that and the outcomes that they want. Like if somebody just says, I just want my ankle not to hurt anymore. That's one thing. If let's say they've sprained it, I don't want my ankle to hurt anymore, and I want to get back to playing competitive basketball. These are different things. You're talking about, one thing is shorter duration, much more simplified. The other one, it requires a lot more return to sport work, and it's going to require a lot more time and management from somebody who's very skilled and knows what they're doing. So same injury, different outcomes that they want. So you have to be able to understand the outcome, understand what you need to do as a scope of practice is concerned, and then let them know this is the duration of time that it's going to take to work with you. And during that time, it's going to look like this. And you can lay out what that plan looks like. Now, the reason that I like this far better, aside from the fact that financially it makes a lot more sense on the business side, is that the patient has a finite amount of time to get the outcome that they want. You are in charge of their plan of care. They're not in charge of their plan of care. And if you thought compliance was high when people were paying out of pocket to work with a cash-based clinic, wait until they have a defined end to their plan of care. That is an interesting thing to see and to get feedback on, where people are incredibly compliant in cash-based clinics, and they're even more compliant whenever they have a duration of time. It also allows us to be able to disassociate visits from trading our time for money, basically, right? Let's say that you have something like a shockwave, or you have blood flow restriction cuffs, or something like that you like to use with people for different types of injuries to help get the outcomes that they want. Well, now what you get a chance to do is you get to build these programs that incorporate these things all together, and it's a far more productized, seamless sales process versus trying to do one-off things with Shockwave and BFR or whatever it is you're going to do. Now it's all part of one package, so it becomes an easier sales process to fulfill and sell as a clinician, which is a hard thing for people to do that are coming out of school and have no sales experience whatsoever, or are coming out of a clinic where they have no experience whatsoever. And that's a hard thing to learn. This makes it easier, which is great for you at scale, because people can come in and they can convert at a higher percentage, from day one. So, as I look at this, I want to share this information because, we're making a shift in how we teach sales. Create offer, have offer construction, education around how we would build these, and even how these lead into continuity offers, which are even, in my opinion, a bigger component of this, a more valuable component of this, because of the increase in lifetime value per patient. So if your lifetime value is how much somebody pays you over the lifetime that they work with your business, that goes up the more people you get a chance to work with long term. What else happens is that patient gets to work on things very much proactively, and they end up living a higher performance, lower pain-free life, right? So that's what they want. They want to live a high performance, pain-free life. We want to help them do that. And now we fit in a really natural way to help them long-term in this relationship where we are less dependent on new patients. So logistically, what's the catch? It's a little bit more challenging. As far as super bills are concerned, the way in which you have to manage that, managing the time duration that people have with you, managing staff whenever they're out of town, if there's a duration of time that they're seeing somebody, there's lots of different solves for this. It's not that complex, but this is the friction that stops people from making changes in a business model that we see over and over again. And sometimes it's just like, oh, I have to change the way I do super bills. That's enough to stop somebody. And it is kind of funny to see that's the case. It's like, oh, I have to change the way I do super bills. I'm out. And yet you could increase your average visit rate by if you could increase your average visit rate by 20%, but you had to change the way you did super bills, that required just a little bit more time on your behalf to do so. Would you do it? And not only that, but what percentage of your population actually gets a super bill? For most of the people we work with, it's 20%. So not only is it a little bit, but it's a little bit more work on a fraction of the people that are coming in, not everybody. So, I think that this is something just to keep an eye on. We're going to have more, resources and education. They're going to come out on this specifically. This is something that we're now helping a lot of people in our mastermind implement directly. This is something that's a big emphasis for us in Q1 of this year as well. I think that this is just something that you're going to see a lot more people talk about. Let me just preface that, right? I think that any time that this is something that we start to really lean into, you'll see a lot of other people in the profession that are doing similar things, and the business education side are probably going to do similar things and call it something different, which doesn't really matter. I think it's the best route to go, whether you're learning this from somebody else or from us. But just know that this came from last year, 10 months of testing, and now, dozens of clinics that we've had go through this. So when we put our name behind a change in a business model, it's not because we just, thought it would be a cool idea, or we did this with one clinic. This took a very, very long time. And it took a lot of data points for us to get to the point where we felt comfortable rolling this out, because we work with hundreds of clinics across the country actively. We take that very seriously. We want to help these business owners, grow and be on the tip of the spear for what things are working now and what they can do to have a edge in their business and an advantage in their area. But this is something that I honestly think at this point, it is a meaningful enough amount of data and positive changes that we've seen that, it's enough worth to be able to share that. And I hope that this is something that you look at in your own business. How can you take the front end of the business, restructure it in a way that aligns better with the outcomes that people want and less about just the visits that you have to sell them, right? This takes us slightly away from exchanging our time for money, from a one-to-one exchange for an hour of your time for whatever they're going to pay for that. When in actuality, there's a lot of work that you do around that. There's a lot of expertise that you've built, and also the outcome doesn't necessarily need to be dictated by a number of sessions. If somebody sees you for 3 months and they come in 5 times, but they get the same outcome as somebody that came in 10 times, you can make a strong statement that you've been able to do that same thing in 5 hours of their time versus 10, whether that be through, whatever mixture of things you're doing, or better remote management, better compliance, better education, whatever it is, you've saved them 5 hours of having to come into your clinic. For most people, they're very time sensitive. They're very busy. They would take that exchange. I mean, if you could do it in one visit and they get the exact same outcome, they probably would do that. So I want you to start to shift the way that you're looking at what do people value. They do not value visits with you as much as you think that they do. They value the outcome. They value their time. Your visits are necessary to help them get that, but at a certain point, they don't want more than they need. It's a burden, right? So this was a big shift that we, really we're looking at making last year, and it's become more and more obvious that this is the kind of the route to go. So I wanted to share this data. I think it's interesting. It's something that we thought would be a better option, but to really see it in real time in clinics, they're doing this. In fact, even in our own clinic, we just flipped this this year to do outcomes-based approach. And the same thing with my business partner, Eve Gigi. Like, this is the direction that we're going, and we're really, I'm not saying that everybody has to do this, because for some people it doesn't make sense, and there's nuances to how you would do that in the business model. But for the vast majority of people, I would say 80% of clinics that we work with, it makes a lot of sense to go this route. And again, like I said, you can still scale these businesses very well in a traditional visit-based, package-based approach. It is not the only way, but small incremental changes and progress over time is what makes a big difference, over years and years and years, as we are able to, improve these things by 5-10% each time. And next thing you know, we have a far superior business model. And we're always constantly trying to work on how could this be better? How could this be better? What can we test? And we test a lot of stuff that doesn't work, and and we don't share that because it's not really even necessary. But the stuff that does, we want to share with the community. We want to share with our profession. And I hope that you find this as interesting as I do. When you look at the business model and the ways in which we can make these changes and have an impact on the people that we're working with, as well as the business that we have, I think it's a really cool win-win situation. So anyway, hope that you enjoyed this one. Hope you start taking a look at outcomes versus just visits. We have more to share on this, but as always, thanks so much for watching and listening, and I'll catch you in the next one.